All right. All right. Good afternoon, everybody, and thank you for everyone who's attending this webinar. My name is Madison Elliott, and I am the Addictions Interventionist here at Talbot County Public Schools. If anyone needs help finding resources, referring a student, or other questions related to, drug or addiction, feel free to contact me. I posted my information on the Zoom invite actually, and I'm more than happy to put my number and email address in the chat if anybody needs it. And like I said earlier, audience, I asked that questions to be saved at the end of the presentations. You won't be able to be heard through a webinar, but you're able to use the chat option at the bottom of your screen. And yes, Rob, this will be recorded. At the bottom of your screen, and you can just type in questions throughout the presentation, and I will read the questions out loud at the end. And then either me or one of our guest speakers here will answer the questions for you. So we have 3 guest speakers from the health department. We have Logan Harris, Beth Williams, and Julie Jones. Thank you guys. Thank you so much for presenting. I'm going to pass it along to you to introduce yourselves and get started. Logan, I'm going to make you a host. Let's see, make host. All right, you are the host now.
Alrighty, so I'm trying to figure this out. Okay. All right. So if I'm not looking at the screen, it's because I have 2 other screens going. So I'm going to introduce myself. My name is Logan, and I work at the Talbot County Health Department in the Prevention Department. And with me today is Julie Jones, and she works for the Dorchester County Health Department in the tobacco program. Can everyone see my screen?
I cannot see the screen yet.
You can't see my screen?
It might take a minute to.
Okay, hold on 1 second. All right. Madison, it's not giving me the option to share my screen.
You are the host. You see at the bottom where it says share screen?
It's not giving me that option. There it goes. Hold on.
Yep. Okay.
Got it now?
Yep.
Okay, cool.
Everyone can see Logan's screen? Yeah. Awesome.
All right.
Okay.
Why is it not working? No, it's not working.
What's not working?
I'm trying to press from the beginning.
I see the beginning.
Yeah, I'm trying to go to slideshow and it's not working. You see it now on this one?
Yeah.
Okay.
Your screen changed. Yeah.
Okay. So we're going to be talking about everything you need to know about vapes and nicotine products, and that there's no such thing as a safe tobacco product. Almost all ESDs or electronic smoking devices have nicotine in them. So according to the 2020 National Youth Tobacco Survey, a sharp decline did happen with the percentages of electric smoking devices. But despite that, positive changes from last year, youth e-cigarette remains a serious public health crisis. So unfortunately, we don't have super up-to-date statistics according to the state, but we do have some statistics back from 2018 in comparison to 2014 for Talbot County and Dorchester County. Julie and I work pretty close together with a lot of our tobacco-related issues. So Back in 2014, for electronic smoking devices, 8.7% for middle school students. So it was a 8.7% that middle school students did use electronic smoking devices. And then it raised in 2018 for Talbot County for middle school students to 14.8%. We haven't got any more recent studies or recent data for a more recent year currently, but and then in 2014, the rate was 23.1% for high school students. And then in 2014, that was it. And then 2018, it raised up to 35.6%. And then even for Dorchester County, similar results, 9.7 for middle school students in 2014, which then raised in 2018 to 11%. And then in 2014, 25.8 for high school students, which then in 2018 went to 34.8%. So it surged from 2019 to 2020 with the disposables. So a lot of the teens, unfortunately, are moving to the disposable stuff. So they'll buy the something called puff bars or anything that they can buy and get rid of quickly because they're cheaper. And we'll kind of be talking about that in the next slide a little bit. So this is what a puff bar looks like. They are disposable products. So Juuls is out. That's not the cool fad thing anymore. They're priced much lower. They're pre-charged, they're pre-filled. So once you get your however many puffs out of them, all you have to do is throw them away and you just buy another one. They resemble a USB flash drive. Teens can obtain them and throw them away easily. They don't need to be stored at any temperature or anything like that. Youth experiment with them. These also use nicotine salts, so they're higher level of delivery and nicotine, so they're less irritation for the youth. They have a lot of bright flavors, bright packaging and many flavors. So as you can see, like Cool Mint, like OMG and things like that. More than 8 out of 10 current youth e-cig users are using the flavor e-cigarettes. But in February 2020, the Maryland Comptroller announced seizing the sales and marketing of cartridge-based disposable electronic cigarette devices or smoking devices containing flavors. So things like the puff bars were being implemented to be taken off the shelves. I don't know about all of them, but they were working on taking these off the shelves of a lot of stores. So hopefully by this time now, they're off the shelves. All right, Julie.
Okay, my turn. Hi, all. So I'm going to run through a few of the risks of vaping. And I'm going to run through these fast and follow up on some other ones. But nicotine addiction, of course, is a huge risk. And decreased physical performance, we kind of think that might be something that might help youth to not want to be vaping because it can affect them in activities and sports. Nicotine poisoning, where they actually get way more nicotine than they should in the first place, but it could be enough to provide, result in nicotine poisoning. Mood disorders, so it can cause youth to be depressed or have more anxiety or more depression. Not that they don't already have a lot of anxiety these days, but it can amplify that. And there's also unintended injuries, where when some people have had, battery operated ones, which most of them are operated through a coil or the battery or a heating unit. But anyhow, they've had before where they've caught fire in somebody's pants pocket. And they've also had some that have exploded and parts of the electronic smoking device went into their throat. So they are definitely some risks. But in the short term, vaping can also cause throat irritation and worsen any respiratory issues and conditions like asthma and bronchitis. So we were saying before that nicotine addiction is a huge risk of vaping, and they can actually appear within a few days or week after first vaping. Another thing that that is extremely important is that what nicotine does, and a lot of youth do not think that nicotine is in vaping products, but nicotine is in almost all vaping products or any electronic smoking device. And what nicotine can do is it can change the brain chemistry, making them more susceptible to addiction, but also it just affects, it can almost like rewire their brain. And young people's brain is not fully developed until their 20s. And so, you know, smokers of regular cigarettes as well as electronic smoking devices, the majority of them start before 18, of course. And so, you know, that's very young and all their brains are still developing. So it's very important to help these youths to quit or to not start in the first place. And another thing that we like to emphasize is that a lot of people think that vaping as well as cigarette smoking reduces stress. And a lot of times what it's actually reducing is the addiction to the nicotine in that moment. But in actuality, it can make the stress stronger and worse.
So we figured it would be good to throw in a slide about vaping and COVID, especially during a pandemic. And a lot of this that I'm going to be reading off is from the Journal of Adolescent Health. So studies show that youth are more likely to share vaping or nicotine devices with peers and friends, which increases the risk of contracting COVID-19 virus. Studies show that those who vape or smoke have a higher risk of COVID-19. Young people who reported ever using e-cigarettes were 5 times more likely to be diagnosed with COVID-19 compared to their non-vaping peers. Those who reported both e-cigarette and cigarette use in the past 30 days were nearly 7 times more likely to receive a positive diagnosis, and were also 5 times more likely to experience COVID-19 related symptoms compared to those who have never smoked or vaped. So young teens and young adults who vape are significantly higher risk. So of course, vaping can lead to an increased risk of addiction to other substances. Youth who use nicotine products are at an increased risk. Youth who vape or use these devices are over 3 times more likely to become frequent smokers. And we found this source from the Journal of American Medicine.
We know that a lot of parents are concerned about their youth vaping, whether they are vaping or not vaping. So here are a few ways that you can, or signs that can let you know or give you, some ideas or closer understanding that they might be vaping. And so if your teen or young adult is doing any of these activities, like spending more money than usual, purchasing some unexplained purchases that you really don't know what they are, like unfamiliar things as chargers and coils, batteries, and of course flash drives, because a lot of the electronic smoking devices actually look like flash drives. if you smell any sweet, fruity, or menthol smells coming out of their room, or if they were in the bathroom or something like that, if you're finding any small vials or eyedropper bottles, a lot of times vaping affects use eyes, so they have red eyes, so they use a lot of eye drops. If they're having more headaches or nausea than usual, and of course any changes in their behavior, if they're more irritable or anxious, or having learning difficulties that they didn't have before. Now, it's very important for parents to be knowledgeable about what is out there. And the tobacco and electronic smoking devices companies are always reaching out to youth. And so they're always trying to find ways to get youth interested into vaping or regular smoking, right? So we know that one of the things that really allures kids is that they can be very stealthy, right? Where they're hard to recognize what they are. And so, of course, we talked about like Puff Daddy, Puff bars, and Juuls, and other brands look just like USB drives. But there's also smart watches that are watches that look exactly like a smartwatch that is actually an electronic smoking device. And if you see here, there's sweatshirts that the smoking device and apparatus is actually part of the sweatshirt. So you think about it, how many kids chew on the end of their hoodie strings. I know I used to do that as a kid, and now it makes you think, okay, are they really just chewing on that, or are they smoking, or are they vaping? There's also electronic smoking devices that look just like fidget spinners and backpacks. If you'll see the picture of the young girl being in nature, but she is vaping, and the vaping apparatus and everything is within the backpack. And there's also ones that look just like gaming devices, like kind of like a Game Boy type of thing. So one thing is that the companies are trying very hard to make this easy for youth to smoke and vape. The FDA has taken some action to remove these products from the marketplace, but it's just important to know that some electronic smoking devices or products can hide in plain sight. So we were talking a little bit about the tobacco companies and the youth targeting. They often use pictures like this, and we use this slide when we're talking to youth to get them to really look at the advertising that's out there, to understand why they're trying, what they're trying to say, and how they're trying to get kids and young people to smoke. And if you see, like in the center one, a lot of geometric shapes and bright colors next to a young looking model who looks like she's just having the best time of her life, that caters to younger and the more energetic crowd. They often in their ads don't have many words. So it kind of, they'll only have like a link to a product. So that way it keeps the youth in the dark more. They often emphasize sharing, as if sharing electronic smoking device with others is a really good thing. Oftentimes the warning label is just very, very small and placed apart somewhere in the photo where you can't really see it. And on your left, where you see the picture of the two guys with all the smoke, they actually have competitions online to see who can make the biggest or the wildest smoke ring. And they actually can win thousands of dollars. And there's many, many memes and cartoons on Twitter. And also they've done reposting of Snapchat videos of youth, especially juuling. And so they really strive to portray vaping as a normal social behavior and as something that's glamorous and rebellious and also edgy. Thank you. Thank you, Logan. So the Truth Initiative had a study, and they found that youth and young adults who watch a lot of TV shows or popular streaming that contain a lot of tobacco images are 3 times more likely to start vaping compared to the peers with no exposure. And the research has also found that the higher the exposure, the greater the odds of subsequent vaping or starting to vape. And that's really concerning, especially in this age of binge watching. And we're all home during COVID restrictions and watching a lot of TV. And one thing that I would like to note is that since the 1980s, cigarettes and the little cigars have been prohibited from broadcast media. I'm sorry, since 1970s, the cigarettes and little cigars were prohibited from media and smokeless tobacco products since the 1980s. But the vaping devices are able to advertise on TVs, in movies, magazines, newspapers, social media, and other mediums. So as a result, youth are seeing advertising for nicotine products for the first time in nearly 50 years. And I know that I've actually, in some of the popular TV shows and movies, there's quite a few people, and some of them are teenagers in high school who are vaping. So this is a huge concern.
So now we're going to talk about tips for talking with your teens. So there's three tips. So listen, blame the flavors, and talk science. So the first one, when it comes to listen, so whether your child or your teen has tried vaping or not, they'll benefit from talking to them about it. And of course, a good talk starts with like listening to them. So an open dialogue is far more effective than lecturing them about, everything that comes with vaping and e-cigarettes. Starting with a softer approach is a lot better than a lecture. Conversation starters, something like, I've learned how much nicotine's in vape products, what have you heard about the products itself? Engaging them in conversation to share more information together, and just tell the kids or the teens, what you know, and kind of ask them what it's like to be around other teens and kids who vape, like at school or just in their peer group and things like that. So blaming the flavors. Vaping has grown so fast due to the amount of flavors. So blame the fact on the flavors. About 97% of kids who vape report using flavors. So that's a significant amount. The fun flavors and the catchy slang terms of the flavors and things like that are what, grabs the teens into using them. And teens usually think that they're harmless, but the chemicals inside of those, damage the youth's lungs as well. There's not a harmless vaping flavor or tool at all. And then talking to science, the main thing that youth and teens need to know is that nicotine is addictive. I think some teens know, and some teens don't. They should understand that nicotine does play a really big impact on the brain. And as Julie stated earlier, it does in a way change the connections in the brain, and it makes it harder for kids, teens, young adults to learn and pay attention, which can cause even school activities to kind of play a role in that as well. So express firm expectations that your kids need to remain nicotine free, but set a positive example as well. So there's gonna be a couple slides that talk about be ready for excuses, and we're gonna kind of just talk through each of them. So if your child or your teen says it's not mine, these are some things that you could say, like, I hope it's not yours, but I get that you might be tempted to try vaping. I'm worried because vaping can be addictive, and it can change the way your brain works. It's not that I don't trust you, but I just know that I'm paying attention. So just let them know that you're paying attention. You know, you might have found something in their book bag, or like the signs and the risks that Julie had talked about earlier, something that they might have in their room. So just let them know that you are paying attention and that you know that you've seen something, but you trust them, and hopefully that they'll be honest with you. Excuse number 2, the kid or the teen may say it's not nicotine, it's just water and flavors. You could say it's not water vapor, it's aerosol that contains metals, toxic chemicals, particulates, all kinds of stuff. The flavors are added to the mess, the harshness of vaping, so people will smoke more. So it's not just what kids think is in them. There's a lot more going on in these vape products. A lot of times we get that excuse, there's nothing in there that's bad for me, it's better than cigarettes. No, that's not the case at all. Excuse number 3, vaping is safer than smoking cigarettes. There's actually nothing safe about vaping. Many vapes add nicotine salts that cause the nicotine to be absorbed faster. So a lot of times when people are vaping, they're vaping more frequent and more often than when they were smoking cigarettes. So that's something to keep in mind as well. And then the last excuse is nicotine is just a little buzz. Nicotine releases a chemical called dopamine in the brain, which might make you feel good for a short time, but when you are young and your brain is still developing, nicotine can do lasting, even permanent damage. So we don't want that to happen to the young kids at all. Go ahead, Julie.
So a lot of youth give, quite a few reasons for why they started vaping in the first place, such as, to experiment, to see what it's like, because it tastes good, to have a good time with my friends, because they think everybody else is doing it, which is not true. But so those reasons can sometimes seem relatively frivolous to the reasons why, what drives them to actually want to quit. And you'll see that the reasons that drives them to quit are far more serious and often heartbreaking. For instance, almost half of the youth in this was a study of This Is Quitting teens. So This Is Quitting is a quit vaping program from the Truth Initiative that it can be a web-based or actually a phone-based with using texting. So this study came from youth actually enrolled in that program. And more than half of them cited health concerns was what was driving them to quit. And cost was the second most common reason for wanting to quit. And of course, some of them were quitting because they wanted to live free from this addiction. And also people's impressions of them, those type of social factors were also one of the things that they cited for wanting to quit. And so there are lots of programs to help people, help youth to to quit smoking or to be educated more on vaping. And thank you, Luke. But before I talk about them, I wanted to talk about a little bit about some of the challenges that are out there regarding prevention of youth vaping. Of course, marketing is one of the big ones because advertising, like we talked about before, is directed towards youth. The flavors that they put out actually draw youth and young adults to start vaping. In fact, like 97% of all youth who vape use flavored e-cigarettes. That's one of the reasons why they're trying to get all the flavored vaping products or electronic smoking devices off the market. It's also, a lot of youth view it as socially acceptable. 44% believe their peers approve of vaping, where 23% of them believe their peers approved of cigarette smoking. So it's interesting that a lot of youth really frown upon cigarette smoking, and they think that vaping is very different. And so they have a sense that more of their peers have positive attitudes towards vaping versus regular cigarettes. So there's also the sense that they think that everybody is doing it, or a lot more people are doing it, so they feel like they want to fit in. And we've heard before that many vape because their friends, their peers, or their siblings vape. Access and availability. There's a study where youth age 15 to 17, 31% said they obtained their main vaping device from a store, a vape shop, or an online retailer. So yes, we have the Tobacco 21 law, but not all stores actually follow that. And both our counties, Talbot County and Dorchester County, do have a tobacco enforcement program where we contract out with our local law enforcement and using a youth or young adult, so someone under the age of 21, to go out and try to purchase tobacco products, which includes all the vaping products also. And it's the hope that they will not sell to them. We also provide education to all the vendors who sell tobacco products. And so not all the stores follow that. Many of them do, but there's also online stores. And sometimes youth get through that by claiming that they're 21, and maybe the actual website does not have really good age verification requirements. So those are weakened so they can get through it that way. Of course, some youth have somebody older who purchases, somebody who is of age to purchase it. Some people who are older than 21 buy them and then sell them to youth. There's also the big challenge of the perception of vaping as a low risk. I talked a little bit before about how youth really frowned upon cigarette smoking, but they feel differently about vaping because they see it as less harmful, better and cheaper than cigarettes. But of course, these perceptions are incorrect because, as we've learned throughout this PowerPoint, is that vaping still presents a number of harms and risks. The other challenge to prevention is the use of vaping products in public places. There are strong smoke-free laws all across the country. But when vaping is not included in the law, there are some people who think that smoke-free laws are not applicable to vaping, so thus feel entitled to vape. And so it's very important that anybody, stores, restaurants, parks, any type of services, add the electronic smoking devices used into their smoke-free laws. And so, okay, it was fine, Logan. So Logan and I wanted to share with you guys as quite a few prevention programs, as well as help for youth or young adults to quit smoking or vaping. And one of the programs is this program here, which is called Smoke Screen. It's actually a video game. And it addresses all kinds of challenges that they can, through the interaction of the game, it helps them to avoid smoking and nicotine vape related behaviors. So for example, some of the scenarios that help youth learn to avoid tobacco use is like decision making about whether or not to throw a party, what to do when another character says that vaping is safe, and how to react when encouraged to try vaping because it tastes good. This game is free for youth or adults to go on and actually go through and play the video game. So that's a very good resource, especially for prevention.
All right, and there's only 2 more slides, so I'm gonna kind of briefly go through these because I know we're running out of time. So these are some digital resources for parents and teens. So teen.smokefree.gov, mylifemyquit.org, the Truth Initiative, which a lot of people have heard of. So I don't know if these could be shared with any of the parents or anyone, but these are definitely good resources. And then the last slide is 2 ways that are 2 resources to help with quitting. So the Truth Initiative has a text program called Ditch Juul, with that number provided there for teens and parents that they can text to get information on how to quit. So they can send daily text messages for up to like weeks at a time to kind of walk you through the quitting process. So that's another good resource. And then the Maryland Quit Line is directly and kind of honed in for Maryland residents, but they do have counselors 24/7. It's for adults and teens. So the ages for the teens are 13 to 17. The teens can receive 5 calls from like a quick coach that they have there to provide weekly calls for them. Educational material can be mailed home for the youth, and they'll talk about triggers, peer influences, secondhand smoke, everything like that. So they're another good resource for teens to have if they're interested in quitting. And then we're just reinforcing that there's no such thing as a safe tobacco or nicotine product. I know that we're way over on our time, so. All right.
All right. Thank you, Logan. Thank you, Joy. That was awesome.
Thank you for listening.
Thank you. Yeah, and I'll definitely share those resources with counselors, social workers, parents, school staff, kind of get those out there. Thank you. All right, Beth, I'm going to bring this over to you, and Beth is presenting on prescription drugs.
Yes, give me 1 sec.
I'm going to make you a host.
Okay.
Change. All right, so you should be able to share your screen.
Okay.
At the bottom where it says share screen.
Okay. Let me fix this to get to my starting point. Here we go. Okay. All right. Why isn't it coming up? Oh, can you see that?
No.
Oh, okay.
Let me see.
Okay. I'm trying to figure out share screen.
What does it say when you click? Oh, here we go.
Okay.
Yep, I can see it.
Yay.
Everyone else can see it.
Everybody good? Okay.
Yep, I think so. Yep.
Okay. Now, are you seeing the side of it too?
Yes.
Okay, I'm probably gonna leave, I don't know how to, let me see.
You can just go up to the top left corner where you usually do full screen
Yeah,
and just click that and it'll take
Okay.
away all the slides on the left side.
the only thing is, I'm gonna be doing it manually here, so. Is this annoying to people, you think, to keep it like this?
I think it'll be okay. I mean, we're seeing the big picture here.
Are you seeing all this stuff at the top too?
Yes.
Okay, I can't find my, make it a bigger screen, so let me see.
Can you just push slideshow?
Yeah.
Okay,
Try that.
Keep going.
I thought that was in the upper left-hand corner.
why don't I see
Keep
it?
going to your right a little bit. Transition, keep going to your
All
right.
the way, keep going. Where's the slideshow?
It's in
All right.
red. I
See,
mean, the wording is in white.
Okay, because what I'm doing here is I've got all this stuff at the top from, all right, hang on, let me go back just to PowerPoint and then do slideshow. Because I'm not able to do it with all this on here. Sugar. I'm sorry.
It's okay. No
So
problem.
do you see where home is?
Yeah,
Home and then insert
yes.
and design. Keep on going to your right, one more.
Where's the
Yeah.
slideshow in the middle?
I can't get to it because on the top has mute and all this other stuff here. So
Oh, you can't move your cursor.
I can move my cursor. I can't see it because it's got
Can
everything.
you move the other screen
Oh, wait a minute.
away from the slideshow button?
Right there, yeah.
Yeah, there you go.
All
And
right,
then from the beginning. Perfect.
perfect. But the only problem is I don't know how to advance the screen now.
You got hit the space bar button.
This is the first time using this computer for
Or
PowerPoint. So
try clicking.
oh, I could do
Usually
that.
use the arrows.
Okay. Yeah, we'll use the arrows. Okay. All righty. So let's, I hope it's not going to do it on its own. Okay. Prescription drugs. We're going to talk about a little bit about that. I'm Beth Williams. I'm from the Talbot County Health Department Prevention Office. I'm a consultant there. I've been in the field since the early 80s. So I'm the old woman of the bunch, but I love the work. I'm passionate about it. So we're going to talk a little bit today about prescription drugs. Now, there's a lot to talk about when you talk about prescription drugs. So hopefully this will be kind of a beginning of maybe some other work we can do or present on specific drugs or, more information about what the trends are, et cetera. But for now, I'm going to kind of give you an overview. It's a lot of information, but I can make the slides. We can print them out. So if folks just want to kind of watch and listen, and we can give you the slides, that'll have all the more in-depth information. Because it's a lot of lists of drugs and slang names and things like that. So, okay, so I'm not sure why this is, let me move this out of the way somewhere. All right. Well, I don't know why it's doing that, but okay. Prescription drugs are only safe and effective when they're used as prescribed, as we all should know by now. That includes the dosage and how often it's taken, and a misuse of a drug can any drug really, but particularly prescribed drugs can result in dependency and addiction. Okay, so why I'm so upset that this is here, but I don't know how to get rid of it. So, okay.
I don't see anything on my side beside the PowerPoint.
Okay, good. Okay. So I'll have to just make it work it on my end. So why is this a concern? Well, misuse is a concern because 60% of teens say they can easily access prescribed medications from their household medicine cabinet. Over half of teens report prescribed medications are easy to get from other people, friends, relatives, other people's medicine cabinets, street buying or trading, stealing, and doctor shopping. These are all very typical and expected behaviors when people are looking to get a drug, particularly once they do become physically dependent on it. We've seen anywhere from real estate open houses where people go in and try to find drugs in the medicine cabinets, to people looking at the obituary pages and seeing that maybe someone died and has painkillers in their home. So there's a lot of that, what we call drug seeking behavior as well that happens. Research shows that abuse of prescription painkillers have similar effects to heroin and often open the door to other substances, street drugs like heroin and fentanyl. Over half of young people who inject first report they've misused prescription opioids. And even as our own sheriff will say, you know, people don't just start using heroin that they buy on the street. They start usually with alcohol, marijuana, that progresses to maybe they want something more. Somebody introduces them to someone's prescribed medication, and then it just goes from there. Okay, so we'll start with opioids, since that's kind of the, you know, we're hearing so much about this right now. And one of the projects that I work on in our office is the Opioid Misuse Prevention Project. And I'll give you that website later. And that's a very good resource for learning all about opioids, including prescribed opioids. Okay, so opioids are any drugs that contain opium or its derivative, which is morphine. It can be a natural or synthetic. It's a prescribed medication, but it can also be purchased illegally and also manufactured illegally. Pill, capsule, powder, or liquid, and can be smoked, swallowed, snorted, or injected. Opioids manage pain and suppress cough. So when someone has surgery or when someone has an injury, they will often be prescribed an opioid drug, and we'll show you some of the examples of those. In excessive amounts, they can suppress a person's urge to breathe. So these are some of the common prescription opioids. If you've been in the hospital, you might have gotten OxyContin, you might have gotten hydrocodone, any of these types of drugs that are prescribed for pain. And you'll also see some of the slang names. Now, I'm going to be sharing a lot of slang names with you, but in the prevention office, we are working on more resources for parents. And one of them we want to put together is kind of a what to look for list and also a slang list, because the slang names can be regional. They can vary by state to state. A certain drug dealer may have their own slang name for their product. So, you know, these can change, but these names on here are what we know of that are some slang names for some of these prescribed opioids. Another examples, we have morphine. Usually you're going to get that at a hospital, or people maybe in end stages of a very serious disease, maybe getting morphine to manage pain. Codeine, you may have had codeine in cough syrup. Methadone and buprenorphine are narcotic or opioid drugs, but they are used to treat opioid addiction. So you may have heard of methadone, where people go to a clinic every day and they get a dose of methadone, and it kind of helps them to not feel withdrawal symptoms, and then they can kind of, you know, work on dealing with the issues around their substance abuse. Prescription fentanyl, we hear a lot about fentanyl these days. Fentanyl has been a widely used prescription drug for pain, and mostly in hospital settings. At the bottom here, you see like a fentanyl lollipop, and that's used maybe for children who are having pain issues. We have the fentanyl patches here, and also in tablets. So fentanyl is a, you know, legitimate pain medication, but of course we hear of it being misused and sold on the streets as well. Signs of opioid abuse. Again, a lot of these slides are going to have a lot of information, so I will probably just highlight certain things on the slides, but the information will be readily available to anyone who would like to have this in writing here. But inability to control use, drowsiness, changes in sleep habits, weight loss, flu-like symptoms, lack of hygiene, changes in exercise, isolation from family and friends, and stealing. Now, if you look at this with opioid abuse, you'll see with pretty much any abuse of a substance, it's basically the same. There's a progression that happens with people that go from experimenting to misusing to becoming addicted. Okay, here's just a little graphic. I'm trying to break it up a little with graphics. Not using pain medication that the doctor, that follows how the doctor prescribed it. Using it. Yeah.
Okay, so are we on the what is an opioid slide?
Yes.
Okay, so you haven't changed the slide yet?
I have changed the slide.
Okay, because we can only see that.
Oh,
slide.
no. All right. How about, have you all seen this one?
It is not moving.
Oh my goodness. Oh my goodness, that's not good. Okay, let me see here.
Are you pressing the arrows at the bottom?
I am. Oh, it's telling me screen sharing is paused. I don't know how that would have happened. What is this?
Not sure.
How about this? No?
Mm-mm.
Oh my gosh, I don't know what's happening then. Let me share. How about this?
Yeah, we can see it now.
Okay, okay. So let me just go back. I was talking, so I'll just kind of show you all kind of what some of these pills look like. These are prescribed opioids. What's our time frame, Madison, for today?
Well, it is 3:57. Hoping to get off of here at 4, but just
Okay,
take your time.
okay.
Finish up. Take your time. No problem.
Okay. Because there is a lot to cover here. We could maybe do the opioids today and do the rest another time.
This is also being recorded, so
Okay.
this will be posted on the website.
Okay, so we'll run through the whole thing, and if folks have to drop off, that's, you know, hopefully they won't, but we'll go through. So here are some other, you know, dexmethadone and buprenorphine are what is used in opioid treatment. Okay, here's prescription fentanyl. We talked a little bit about this as a patch right here. Okay, signs of opioid abuse, we kind of went through, and I'll just keep going and we'll move forward. Okay, so this is just a little graphic that shows, you know, how people can tell that their opioid use is turning into abuse. And it's, you know, using it for reasons other than it was prescribed, spending a lot of time trying to obtain the drug, turning to snorting or injecting the drug, etc. Okay, so depressants, we're going to move now from opioids into depressants. Okay, more general depressants, drugs that are classified as those that depress or slow down, calm down the central nervous system. Sedatives, tranquilizers, anesthetics, medications that treat anxiety and insomnia and prevent seizures. So I'm going to go through, this is a lot of information, but I'm just going to kind of go through some of the categories of depressants. So benzodiazepines, they're very common. You can see a lot of people out there may have heard of these or used these, Valium, Ativan, those kind of things. Mostly used for seizure disorders. These type of drugs, Xanax, Librium, Valium again, Tranxene, may be used for anxiety disorders. Benzodiazepines may include Restoril, Halcion, which are used for insomnia. This is kind of just a general picture of what some of these prescribed drugs look like. Many, many different colors of many pills. And actually we have a really good brochure at our office that opens up to a very large picture of what each of these specific drugs look like. But I would say to parents, anytime you see any kind of pills or capsules that you don't know what they are, you know, be a little bit suspicious of that. Okay, anesthesia, if anybody's ever had surgery, you've had Versed or Ativan or Valium. Valium is also used for many other things like muscle relaxation. So slang names for benzodiazepines or benzos, which is one of the slang names. You can see, you know, Xannies, bars, planks, Klonopin, K-Pin, Super Valium, Librium and Ativan, and just general names, benzos, downers, nerve pills. You know, downers is a very popular, it's been around forever. Just like we would call stimulants uppers, we would call depressants downers. Okay, commonly prescribed, and this is what they look like. These are very commonly prescribed with the exception of Rohypnol. And if that sounds familiar, that's because that's considered a date rape drug. Rohypnol right now has no approved medical use in the United States. So that if somebody has Rohypnol, it's illicitly made and distributed. Okay, side effects, again, sedation, weakness, dizziness, unsteadiness, all of those types of things. Again, anything that's kind of depressing or slowing down the system. Okay. So barbiturates, the same kind of thing. What you need to know really is that they are depressants, but they are largely replaced by the benzos. So a lot of these medications that you'll recognize are not really widely used anymore. Those that are like for epilepsy or seizure disorders, and when somebody needs sedation. Okay, I know, I'm trying to run through these. I don't know, you can stop me anytime, but.
It's okay, it's okay.
Okay, let me go through stimulants, because as we had depressants, stimulants, which are amphetamines, are very popular right now, very popular right now. And I think folks are going to look at some of these and go, wow, I didn't know that. Used to improve focus and reduce impulsivity. This is what they use to treat young people with ADHD and also people with narcolepsy. So Adderall, we hear a lot about that, and Ritalin. Adderall and Ritalin are being shared by kids in school. There's a large presence of it among peers that they share it. And some of the others that we can go over, like weight loss drugs and things like that. Okay, slang names for stimulants: Addies, uppers, beans, black beauties, pep pills, Dexies, smart buddies. Okay, so that's for Adderall. Here's kind of what Adderall looks like. It's usually labeled right on the pill or on the capsule and some initials on the pill. Slang names for stimulants: cough syrup and dextromethorphan are being used quite frequently. In fact, Logan, we talk a lot about some of the media references to these drugs, and you'll see on the bottom, drank, purple drank, combining cough syrup with soda. There are songs out there that refer to cough syrup. It is very popularly used right now, misused. Of course, you can buy it over the counter, although some of the pharmacies do require some ID and things like that, but kids are using a lot of cough syrup. So when if you have a sick person at home, you may want to look at the products that you have and see if it has DM, which is dextromethorphan. Again, it is widely used by kids to get high, or actually kind of more mellow and relaxed and all of that. Slang names for Ritalin, I'm kind of hopping around here a little bit, but same as, Ritalin is also a drug that's used for ADHD purposes, but you can see some of the names that they're called. Skittles is a real popular name for some of these drugs, Smarties, those kind of things. Okay, this is what Ritalin looks like. Again, legitimately prescribed, as Adderall is for many, many people that do need it, but it is a drug that is very commonly abused. Side effects of stimulants: loss of appetite. Again, anything that's opposite of what a depressant side effect would look like. These are drugs that pump people up. It gets them going, it gets them hyper, it gets them that they can't sleep, they get nervous, they get, just wound up. So that's kind of, just in general, what to look for. Can cause the, hallucinations, pulse and heart problems. A lot of people on stimulants exhibit a lot of really aggressive behavior. Okay, I am going to talk a minute about ketamine because we are seeing some ketamine. Ketamine is, it can also be called Ketalar or Ketaset for human use, Ketavet for animal use. They are not the same dosage wise, but people are trying to access it through veterinarians offices. It's used as a tranquilizer or for general anesthetic. It's considered a dissociative anesthetic, which it means it can cause kind of some out-of-body experiences. People seem really kind of out of it. It is, however, being studied, as are some other psychedelic type drugs, for the study and treatment of PTSD and severe depression. But for now, there is very limited use for humans. Okay, that's what it looks like. It comes in an injection. If you're in the hospital or if you're with your pet at the vet, it's going to come in a little vial like this. It can come in a capsule. It can come in pills. Keep in mind that anything that comes in a capsule or a pill can be crushed so that it can be injected, it can be smoked, it can be snorted intranasally. So, just because you might not see evidence of pills, but a parent may see evidence of powdery substance or baggies that have powdery substance, that is certainly a huge indicator. So side effects of ketamine: slowed breathing and something they call K-hole, which I thought was interesting. It's an out-of-body experience that people feel separated from their body, or kind of, experiencing their surroundings in unusual ways. Okay, slang names we hear a lot: K, ket, horse, horsey, those kind of things, cat Valium, all of that. Okay. Dextromethorphan, this is what we had talked about before, but that's in the cough syrup. I don't know how the slide got here, but it's not necessarily a it's kind of a combination of a stimulant, sedative, and dissociative property. So kids using this are going to feel, you know, some blurred vision, drowsiness, dizziness, unsteady walking, that kind of thing. Dangerous if it gets to the point where their breathing is slowed down. Okay, slang terms for that. I think we talked about that before, but again, Skittles, syrup, Dex, Tussin. Okay. Farming parties. This is something important for parents to know if they don't already know. We do know that people in our county, young people, are having what they call farming parties. And what they do is they find either in their own medicine cabinets or other people's medicine cabinets, prescription medications. Now, this may even go beyond the things that we talked about today. This could be any kind of medication that's in the medicine cabinet. And they bring them to gatherings with their peers and mix them all together like in a big container or big bowl. And then they just take turns taking handfuls of these pills and ingesting them. So of course you don't know what you're getting. You don't know what dose it is. You don't know, are you taking your dad's blood pressure medication along with, your mom's antidepressant and your brother's Ritalin meds all in one thing. I mean, very, very dangerous. It's very rare right now for in the substance abuse world for there to be just use of one single substance. It used to be somebody who just did pot or just did heroin or just did cocaine or just did prescriptions. Now we're seeing poly drug use where it's all kind of mixed together. Logan and I went to a conference that there's great information we can share with parents at some point. And the guy that presented was a police officer, and he called what's going on in the drug world now drug spaghetti, because everything's intermixed together. And a lot of these young people really don't have a preference. They just want to get to a point where they don't have to feel things anymore. Our kids are in a lot of pain right now. And so that is why we're seeing a lot of these, especially calming kinds of drugs that are being abused. So just as a wrap up quick, safe medication use is always to take it only as prescribed for the person it's prescribed with, never to share. If a person has breathing problems, they should check with a doctor before taking opioids and be extremely careful in taking opioids, and never mix pain medication with anything else that could counter its effects or increase the effects. Okay, so part of prevention, and Logan talked about a lot of this, tips for parents, and I would completely echo what she said in terms of keeping the lines of communication open. The secret we have to look at is supply and demand. And if we decrease the supply, we decrease the access of what folks can get into. That is a huge piece. That's what the law enforcement officers do. That's what parents do. That's what anybody can do, is stop or decrease access. So to that end, keep medicine in a safe place, such as a locked cabinet, medication safes and locking pods or pill bottles are helpful, and then safe storage and appropriate disposal. And that can be done at the drug drop boxes, and they're listed there. Talbot County Sheriff is 24-hour, Maryland State Police is 24-hour, Oxford is 9 to 4 or by appointment. St. Michael's Police Station, they have a drug drop box, but right now it is not safe to use it because you can't socially distance. So they give away deterra bags. So I'm going to tell you about those in a minute. This is a prescription drug box. It's similar to the one at the sheriff's office. These are deterra bags and dispose RX. So if someone cannot access a drop box or they don't feel safe going out for whatever reason, we have these, and they are systems that people can use. They put their drugs into the bag, or they put this dispose RX into their medication, and they can safely throw it away. And we can give you more information on that. These are safe storage tools. This is a pill pod that locks, that people can keep their legitimately prescribed medications in and out of other people's hands that shouldn't have them. And this is a locking medication box. So the prevention office, we make available to the community storage and disposal items that you just saw: tobacco, alcohol, and drug information, Narcan training, which reverses opioid overdoses. And when we are permitted to open up and do outreach, we do outreach to community. Right now, it's mostly been on virtual settings. Prevention tips. along with what Logan said, reduce the supply and the demand. We have to look at why it is our kids are feeling they have to use something. And even if all the supply in the world was gotten rid of, a kid can probably find a way to get high on something that's under their kitchen sink or in their bathroom cabinet. So we have to always reduce the supply, but we have to really start looking at why do our kids feel they need to use. Protective factors, one of them, keep your kids involved, keep involved with them, have dinner together. Research shows that kids are overwhelmingly less likely and reporting less drug use if the family just has dinner together, any meal together. It could be breakfast, it could be coffee, but there has to be that kind of family integration and involvement that happens. Yes, it's hard to do, but it is certainly a huge protective factor. Know the enemy, and there's a lot of this out there now. There's a lot of good material out here about what to look for. What are the signs of use? What is the slang? What are the behaviors? And I always say, if one time your adolescent is cranky or grumpy or irritable, that's always to be expected. But, if there are patterns of behavior that are emerging, if they're dressing differently, if their room has, posters that look like it's glorifying drug use, the products that Logan talked about, patterns of behavior that over time are continuing or are getting worse are certainly signs for concern. And then teachable moments. I'm a huge fan of teachable moments. If you see a commercial on TV or a show on TV, it's always great to say, oh my gosh, what did you think of that? Wow, that was really upsetting that person did that. I wonder what led them to that. And you just, open-ended questions and discussion that kids can feel comfortable talking. Again, these are long-term, things that all of us as parents can certainly do that don't require a whole lot of anything other than just our gut instincts as parents. So here are some resources. This is the I Wish I Knew midshore.org website. Has fantastic information for parents. It has a treatment finder if somebody needs treatment, a treatment tool. So that is local. That is the 5 Midshore counties that have put that together. You can always call, of course, other than the health department, who were always there, substance abuse or SAMHSA administration. They have a wonderful hotline, a helpline that they can send materials free of charge. They can help people find treatment. They can help link people with resources in their community. So these are 2 that are really super. There's also Midshore Behavioral Health has a wonderful, I didn't put it on here, but wonderful resource guide that the community can access online. So, hopefully this was helpful, and hope everybody, continues to be safe, and we can all kind of work together to see what we can do about the increasing rates of substance abuse right now, especially with COVID. The rates are really very, very high right now. So we are looking forward to being able to get out in the community again and do some of this really important work. So thank you, Madison, for having us. And,
thank you. That was great, Beth. A lot of great information. Thank you, Logan. Thank you, Julie. Thank you, Beth. Like I said, this is going to be posted on the Talbot County Public Schools website. Does anyone have any questions? If so, go ahead and you can ask the questions in the chat. If not, I'm going to put my email in the chat. So if anyone has any questions regarding this PowerPoint, just email me and I'm gladly to answer any questions. Here's my email. And let's spread the word about the presentation today. I plan on doing monthly seminars. The upcoming ones I want to do in the next 1 to 2 months, tobacco and alcohol. So just look out for that. And if no one has any questions right now, my email is there. Thank you, guys. Thank you. Thank you, everyone from the health department.
Thank you.
And
thank you, everybody.
And I will hopefully see you guys next time.
Great. Thank you.
All right. Thank you. Everyone have a good evening.
Take care, everyone.
Take care.
Bye.
Bye.